You are listening to Sean Harrison on Amp Life Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.
And hello, everybody. For those of you that were on YouTube just watching me, you're probably trying to figure out, what is he doing? He's just sitting there. Well, we had a restart of our soundboard, which means when your soundboard restarts mid-show, it kind of gets rid of all of your clips that you had. And for those of you that are, those of you that listen on Spreaker, and then there's some of you that listen on YouTube, I hope my mic screen is not too big here. I moved it around last minute before I started the show, and it's right in front of my face. So for people that can actually see the show over on YouTube, and I hope it looks like we did get the sound issue cleared up on YouTube. So you should be hearing me tonight on YouTube. I'm not trying to get too close to the mic because then I sound really close to the mic. I like talking away from the mic a little bit. Makes the room sound bigger, but it also just helps me not to breathe so heavy into the mic. I'm a heavy breather, man. So welcome back, everybody, to Amp Life Talk Radio, a show for amputees and those affected by limb loss. I want to welcome all the new people. If you have been on the show before, welcome back. If you're new to the show, welcome. I want to make sure I'm telling you guys how I'm doing things on the show, so it's not a shock to you, because one of the things that has changed with the show going into the new year, shows are going to be shorter. So instead of doing our complete hour-long shows that we typically would do, or 45-minute shows, now they're like about 15 minutes. So bear with me. They're going to be good. They're going to be good. I have to get through all this stuff in the very beginning and just kind of let you guys know some of the new changes. So you're not thinking I'm shortchanging you on a show. We no longer do Facebook Live. We only do our live shows here on YouTube, as long as they don't start messing around with policy changes and messing things up again, because YouTube was kind of doing some things that I wasn't happy about, and it made it kind of hard to be able to do the show. So what I do want to say is this: welcome if you're new, welcome if you're old. We have a chat room here over on our YouTube channel. So subscribe and you can talk to me over here in the chat room as I welcome people who will find themselves in the chat room. I always put up a welcome message. For those of you that subscribe, you will always get a notification that I'm going live. I'm going to get better at going live early every show because we only have 15 minutes. And as I look at the clock, I've already burnt 4 minutes away. So with no more delays, guys, I can't say thank you enough for tuning in, being a part of the show. We're going to try and make this thing really awesome in the new year. When we do have special guests, then we'll have all the things, all the bells and whistles pulled out. We'll have the call-in line up. We're going to have a full unlimited show. If we go for an hour, we go for an hour. But that's typically when I have special guests. When it's just me, it's going to be about 15 minutes. 15-minute power talks on Amp Life Talk Radio. Tonight, if you saw the show clip, what we're going to be talking about is diabetes. Now, I know everybody talks about diabetes. Everybody talks about diabetes. Well, I guess the way I see it is this. If we were getting the message, I wouldn't be talking about diabetes. Kind of feel me? So tonight's show, episode 35, season 3, Amputation and Diabetes, how to protect your feet. I just want to go over this real quick because I think that it's worth repeating. It is well worth repeating. And for those of you that are on YouTube, yes, I'm sipping coffee, burning those late hours, man. I get off work and I come and I do my show. So bear with me. And yes, the show is live. I don't pre-record anything unless it's, necessary. Most of the time, what you're seeing is what's actually happening in my studio. And yes, all my click clack behind me from doing Spartans. Shout out to my team again for pulling in first place Para Spartan Championships, Laughlin, Nevada. Thanks, Spartan, for putting on such a wonderful event. Thanks to all the athletes that also went out there and participated in that. It was really a good time. Back to what we're talking about. Amputation and diabetes, how to protect your feet, man. And that goes to foot if you've already lost one. So tonight we're going to do a crash course. We're going to hit this. We're going to go through it. And I really want you guys to pay attention because, again, I'm going to say, if this was not a necessary issue to talk about and to repeat, I would be out of business. I wouldn't be seeing people, doctors, orthopedic surgeons, podiatrists. We all would be with no patients. But because we do have a problem with amputations and diabetes, we need to make sure that we put proper, good information out there for you. That's what I'm going to attempt to do tonight for you as we get into episode 35, Amp Life Talk Radio. Good diabetes management and regular foot care are worth their weight in gold. They can help prevent severe foot issues, sores, ulcers, difficulties that will end up, if we don't treat them right, in a bad situation, amputation, which is what we want to try and avoid. That's why I want to have this talk with you tonight. So what we want to do is we want to try and make sure we're treating our feet right. We don't want to find ourselves down this road. I saw patients all week long that I have come in contact with, working with, and some did not take this information to heart, and it leads to amputations. It leads to more than one amputation, which is unfortunate, very unfortunate. So I see it daily. That's why I come on here. That's why I talk to you. That's why I try and spread this information to you with my show. I know there's a lot of people starting up podcasts talking about different things, but for me, boys and girls, I live this. I see it. As an amputee myself, I'm trying to put preventative stuff out there to where all you have to do is lend me your ear and listen to what I have to say, and it may save you down the road from going into surgery. Diabetes and the complications can include nerve damage. We know that. Poor blood circulation. These problems can make the feet very vulnerable to some of the things that come from not taking care of our skin. If we don't do that, we are open to skin sores, ulcers. We all know these can get bad pretty quick. We know that. I've seen it happen. If you're a diabetic, you know what I'm talking about. So one of the things I want to say to you is that the good news, there is always good news. The good news is that with proper diabetes management, meaning taking care of yourself, taking care of your feet, you can prevent foot ulcers. In fact, better diabetes care is probably the number one thing that has led to some of the decrease in some of the cases that we've seen among diabetic patients losing limbs. So I know those numbers aren't doing a big deal with some of the numbers that I have quoted you on some of the shows, how diabetes is at epidemic numbers, but those people that are managing their diabetes and doing the things that we're going to be talking about are helping put a dent in that number. Sorry, my ring hitting the table here. So when foot ulcers do develop, it's important to get proper care. I cannot stress that enough. Guys, I come across people who don't do that and don't take that serious, and it always leads down the same road. I mean, I've been doing this almost 7 years now. Every patient that I see that gets that foot ulcer, if they don't deal with it and don't get immediate help and take care of it, it's going to go down a bad road. In fact, more than 80% of amputations begin with what? Anyone? A foot ulcer. That's the sad part, is that when we see these things, we need to remember that that's the gateway, man. That opens the door. So we really need to make sure seeking care is our first priority when we see something like that. Now, without knowing what to do, we need to understand what factors can lead to an increase in risk for amputation with you as a diabetic patient. Well, I wrote some of those down on my little show notes here, and let's go over them. High blood sugar levels. We need to make sure we're controlling our blood sugar levels and making sure we're staying on top of those things, because they're so important. I see patients and hear about patients coming into the hospital with these outrageous numbers, 200-300, way up there. That's out of control, man. You've got to control that better. Sorry, but I have to hydrate because I am drinking coffee to stay awake. It's a vicious cycle. You drink coffee, you got to drink water. You drink coffee, you got to drink water. Smoking. This is one of the biggest ones that I see, and I try and talk to patients about all the time. Smoking, if you're a diabetic patient, brothers and sisters, if I can give you any advice, stop smoking. That is probably one of the worst things I can see. I can't tell you the damage, the devastation that I've seen for patients who are smoking. They get an ulcer or get an amputation, and they continue to smoke, and things just continually get worse. I mean, even up to the point to where the limb won't heal. They're going higher with the amputation. It can be bad. So these are some factors that you need to watch out for. If you're a diabetic patient, keep these on your hot list. Write these down. Listen to the show. Share the show. High blood pressure, smoking, nerve damage, calluses and corns. Don't do those yourself. Seek professional help. Foot dermatitis, poor blood circulation. If there is a history of foot ulcers, you may need to have a podiatrist on speed dial. A past amputation, that's a red flag right there, my friends. Vision impairment, kidney stones, vision impairment. Why? How many times have I come across a patient walking through their house, stumped their toe, boom, they're in the hospital, getting either other toes amputated or getting their foot amputated. Kidney disease, high blood pressure, what we're talking about, anything above 140 over 80, we need to get in there, man. Get that looked at, get it checked out, get to a doctor. Now, with all of that said, these are some of the factors that get us in that danger zone, get us into that red zone that we don't want to be into. How do we prevent these foot ulcers? How do we do the things that we need to do to get things done? Well, I'll tell you how. The best strategies for preventing complications with your diabetes, including foot ulcers, is proper diabetic management care. Again, there it is. Taking care of your diabetes, healthy diet, regular exercise, blood sugar monitoring. Okay, monitor your blood sugar. Adherence to the prescribed medication regimen that you're on. Take your meds, man. Stay on top of your meds. Now, if we do these things, we've got all these factors working for us. We're doing all these things. Other things that we can do. We're going to go down a checklist here, and I want you to check them with me. I want you to make sure you know these and understand these if you have diabetes, whether you have both feet or one foot. Let's make sure that we're doing these things right here. You know, the biggest thing is inspect your feet. We have to inspect our feet daily, making sure we're checking between all of our toes, checking for blisters, checking for cuts, cracks, sores, redness, tenderness, swelling. If you have any trouble reaching your feet, you need to employ someone, get someone to help you. If you can't do that, get a hand mirror. Start looking at the bottoms of your feet. You'll find things before they get worse. Okay? Ask someone. Don't be ashamed. Ask someone. Wash your feet daily. Clean your feet, man. Clean your feet. Wash your feet with lukewarm water. Nothing hot, especially if you have neuropathy or anything like that where you can't feel. You can boil your feet and get it too hot and burn them. So dry them gently, especially between your toes. Get that water off and between them toes and underneath your toes and in the little toe cracks and crevices. Make sure you're doing that. If you're a little tip that I can tell you is sprinkle some talcum powder or cornstarch between your toes to keep the skin dry so you don't get moisture in there. That's how athletes' foot get started and all these little things, all that moisture left in there. Use a moisturizing cream if you do use one. Use it on the top of your feet, okay? Top of your feet, bottom of your feet. Don't be putting it between your toes, okay? Lotion on the tops and bottoms of your feet. Keep the skin soft, okay? We're trying to prevent any type of cracks. Cracks is where things get into our feet and it gets ugly. You know, the bacteria can get in there, and that's where things can get real ugly. Don't remove calluses or foot lesions, bunions, anything like that. Get your toenails trimmed. Do all this stuff through a professional. There's plenty of people out there that do it. Check with your podiatrist or a doctor. They can probably tell you somewhere where to go get that done. Don't go barefoot. Man, my family's not even diabetic, and I tell my family all the time about wearing shoes when you're walking around the house. Even the house. Yes, there's things that you can step on around the house. Hitting your toe. All different types of things can get started on a bad scale if you're walking around barefooted, and especially going outside. And nobody wants to see them little dirty feet, so put some sandals on. Wear clean socks, man. Don't be wearing socks for 2 and 3 months. I think one of the stories I heard when I first started doing peer visiting was from a guy, and it was out at Santa Clara Medical. And he basically just told us one day he pulled off his socks and his toes fell off. And they were in the sock. Yeah, wear clean, dry socks and change your socks frequently. Don't just wear the same old socks, man. Make sure you're using things that are going to be good for your feet. You know, fibers that pull away moisture and all that stuff from your feet, such as cotton and special acrylic fibers. Not nylon. Avoid socks with tight elastic bands that can cut off your circulation. I'm always wearing footies. I don't wear big long socks up on my legs, so I'm wearing footies. Drink water. Stay hydrated. Buy shoes that fit properly. Don't be crunching your toes into a small shoe, man. Give them big old feet some room to spread out. And if one foot is bigger than the other, buy shoes in the larger size. Your doctor can help you with this, especially if you're trying to do some type of diabetic shoe or anything like that. They can write your prescription to a DME company. Don't smoke. Don't smoke. It comes up again, preventing foot ulcers. Don't smoke, guys. I mean, this is a 15-minute power talk, man, and I'm going to tell you right now, the best advice I can give you is to stop smoking, because if you smoke, you're going to have some things go bad. You know, I know a lot of people want to contradict that, but, you know, I'm not going to sit here and argue with you, because I see it on a daily basis. And once it starts to happen, who was that the other day? I heard Willie Nelson decides he's gonna hang it up. He's done smoking the reefer, man. Willie, it's a little too late. That's all I got to say to that. It's a little bit too late, man, to be thinking about your health now. You have probably puff past some of your best years away. No pun intended. So stop smoking, guys. Schedule regular foot checkups with your podiatrist or your doctor or your medical professional. And last but not least, contact your doctor if you have any of these, guys. You have ingrown toenails, blisters, plantar warts. You have athlete's feet, an open sore or bleeding, swelling, redness, warmth in one area, pain, discoloration to your skin, a foul odor, an ulcer that lasts longer than 1 or 2 weeks. Man, 1 or 2 days, man, get in there. Forget weeks. An ulcer bigger than 3/4 of an inch to 2 centimeters. A sore that doesn't quickly heal or begin to heal. An ulcer so deep you can see the bone. I shouldn't even have to tell you that, guys. So, guys, tonight we tried to just touch on this, deal with this topic. I know it's like beating a dead drum, but it is so important because so many people don't really take care of their feet. And I want to make sure all of you are taking care of your feet. And again, I cannot thank you guys enough for tuning in to another episode of Amp Life Talk Radio. I'm always appreciative of everyone, every single listener I get. I'm so appreciative of you guys. I'm so thankful. I appreciate all the listeners. Again, remember, we don't do Facebook Live. I will post a video from YouTube over there. And hey, guys, if you get a chance, click and subscribe to our YouTube channel as we improve and do things better. I want to make sure you're getting all the episodes and staying up to speed with everything. Again, I'm Sean Harrison. I'm your host here at Amp Life Talk Radio. Thanks for tuning in. You guys have a wonderful, blessed night, and I'll see you on the other side next Wednesday, 6 p.m. Save the time.
You are listening to Sean Harrison on Amp Life Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.